The heart is very important for life, and in times such as these, taking care of it is more important than ever before.
Use heart to beat cardiovascular disease is the theme for this year's World Heart Day commemoration. Cardiovascular disease takes the lives of an estimated 17.9 million people every year, accounting for about 31% of all global deaths.
World Heart Day is a reminder for people across the world to stop and assess lifestyle choices for them and their family, and also take strict steps to ensure that the safety of their health against this disease. The chairman, Nigeria Medical Association, Lagos State Branch, Dr. Adetunji Adenekon, joins us now in the studio. Good morning. Nice to see you.
Good morning.
Good morning.
Great.
Nice to be here.
Now, on a day like this, talking about the heart, talk to us about some of the things we do on a daily basis that can threaten the safety or the health or well-being of the heart.
All right, thank you very much for the question. Some of the things we do on a daily basis is while fending off our economic activities, trying to get a daily job. The stress, the hustle and bustle in Lagos is part of the stress lifestyle. And also, what we eat in the day is also part of it. You eat canned foods, so because you want to get food on the go. You don't even get to cook your food. Get canned food, you take sugar drinks, and all those things are things that can increase to risk factors, like diabetes, hypertension, and all that can predispose the heart to other heart diseases and other heart problems. So these are part of the things we do. We don't even get the time to do any exercise, as the case is, while trying to fend for economic activities.
When you talk about the issue of canned foods, what is in canned foods that is so threatening to the heart?
It is the level of salt that are inside the canned food. Even some of the drinks we're talking about, the level of the sugar. And that's why we are talking about government policies to be on sugar tax, making policies that there should be less salt in the food we take. And those are things that can reduce the risk factors for developing hypertension, diabetes, and the rest. And we're also encouraging that government should formulate policies to make sure that there are areas for people to do exercises. You see people jogging on the road. That's not the way it's supposed to be. There should be some areas like walkway where you can do your normal exercise in the morning, and you know that where you are doing it, no car is going to come and meet you there. And you have this bicycle track that people can ride bicycle, and there should be bicycle park as well that people can have to do some exercises.
All right, some will say that we live in unprecedented times where, because of the pandemic, there is pressure on every side. Some persons, the pressure and the fear of not being infected by the virus, the fear of the economy, talking about how safe your job is going to be, and also the fear of, socializing, that also has come into the mix. How do we ensure that while all of this pressure, we can keep our hearts safe from all of this pressures impacting it?
I'll give you a typical example. During the lockdown, you found out that some of the people we see on TV were doing exercises on the road. That is a good way to make sure that you reduce the pressure of all this news around you.
But the timing could be wrong.
Yeah, the timing could be wrong, but what we are saying is that at least there's an attempt to try and do something. But what we should preach in is that what are the basic preventing factors that we want to talk about. Number one is healthy lifestyle. Healthy lifestyle, if you don't smoke before, don't start smoking. If you smoke, quit smoking. These are things we want to talk about. If you know that before now, you have, like COVID-19 itself, it can cause heart disease, and it can also worsen somebody who has a heart disease. So if part of this is that you don't want to get COVID-19, and why not get it? You should maintain a healthy lifestyle. So if a doctor gives you a clean bill of health today, it's for that moment. It doesn't mean that you don't have any other thing, but for now, you're good. That's what we are saying. Maintain that good, healthy lifestyle. Don't begin to do things that can predispose you to heart diseases.
All right.
And also joining us is cardiothoracic specialist and founder, the Congenital Heart Disease Foundation of Nigeria, Christiana Oyeleye. Good morning, and thank you for joining us.
Good morning.
Nice to see you. Thank you.
All right, I'll start with you, Christiana. Talk to us on a day like this, talking about making strict decisions at ensuring that your heart is safe so you can fight cardiovascular disease. Talk to us what decisions, strict decisions should be, especially when it comes to our lifestyle choices and perhaps nutrition.
Okay, so there are risk factors that predisposes us to cardiovascular diseases. And that, like you already said, those are the preventable and the non-preventable factors. The diets you're talking about now are the controllable factors, which we have control over. And so for our diets, we should incorporate practices that helps us get our heart better, which includes cutting down on our salt consumption, consumption of fatty food and junks. We should instead go for vegetables, fruits.
When you say cutting down on salt intake, is it that we shouldn't at all? What would be the right measurement for intake of salt if you're trying to ensure that your heart is safe?
Okay, so what we're trying to say is that it's not that we should not eat salt at all. We should just cut down on our consumption of salt. You know, some people take salt excessively. So we're trying to tell them that they should reduce their consumption of salt and reduce how much they consume salt and salty snacks. So that's what we're saying.
All right. So salt and junk foods and snacks and even excess sugar and all of those should
that's
be.
That's what a lot of Lagosians live
yeah,
on.
but that's,
exactly.
that is the everyday life these days, especially
Because
when you're on the go and then you just have to grab some of these things and then, and all of that.
So that's where the strict decision comes in now. Perhaps.
So a lot of work to do. Now, let me bring Dr. Adeniko in here. Now, the World Heart Day has been a day that has been commemorated over the years. Now, how best can the day like this be commemorated? What activity should one engage in awareness creation?
All right, thank you very much. Like you said now, awareness creation is key. And in awareness creation, you want to sell the real information you want people to take. Living a healthy lifestyle is what people have had over time. But how to carry out living that healthy lifestyle is what we need to provide. Like I mentioned in the earlier segment, government need to make conscious efforts to be sure that there are room for people to be able to practice healthy lifestyle. Now, like I mentioned, the policy on reduction of salt intake needs to come out. Reduction of sugar, the sugar tax and all those things needs to be there, and implementation of it is very important. Now, I'll remind you that there's a law on smoking. You don't smoke in public places. But how many people have you heard that they caught smoking in public places or arrested for smoking in public places? Active smoking and passive smoking is very injurious to the heart and to other blood vessels. So if you say there's smoking, non-smoking policy or smoking policy are the cases, and people smoke anyhow and where they want to do that, even air pollution is still another factor. And talking about reduction of air pollution, this is also a form of inhaling smoke. So these are things we want to talk about. You make policies, then there must be an enforcement of those policies.
How about alcohol? How
Yes, alcohol,
does it contribute
people talk about taking some particular pint of alcohol or red wine or all those things. But what we know is that excessive alcohol intake increases your risk for cardiovascular diseases.
But we have heard that the red wine, like they say, red wine is good for the heart.
I must tell you that there are a lot of anecdotal evidences. A proper research needs to be done. People talk about using 1 glass cup of red wine, 2 glass cup of red wine, and people say, no, it's not true. So a proper research needs to go into that. But there is no amount of alcohol, because alcohol is good. It gives you some energy to your body. It gives you some energy in calories, which is needed. But excessive alcohol intake is what we preach against.
Okay. Now, one aspect I'd like for you to quickly touch on is the aspect of managing stress, how people should ensure, because that's another aspect that is seen to also cause heart issues. There's so much going on right now. How do people begin to look at balancing their lifestyle, managing stress at a time such as this?
Lagos especially is a place where the stress level is always on the high side. People get to leave work early enough so that you can meet up.
Sleep as well.
Yes. So we should just try to sleep for at least 6 hours per day. That helps our system to rest and help us relax and it also improves our heart function. So it's very, very imperative that we rest enough. Okay, and on weekends, for example, when we do not go to work, it's important that we take conscious effort to rest. You may not have to sleep. Just saying so, we're not exercising, not doing anything is enough rest on its own. So we should adopt such lifestyle practices.
Okay.
All right.
Well, it's really interesting. On one hand, someone said sometime that The hustle and bustle in Lagos is exercise in itself already.
It's not targeted exercise.
Okay. All right. We have to leave it here now.
Here now. Dr. Adetunji Adenekon, Christiana Oyeleye, thank you so much for your time on the Breakfast Show this morning.
Thank you very much.
Thank you.
Thank you.